Okay, today's lecture is going to cover generalized anxiety disorder. And also separation anxiety disorder. So we're first going to introduce the distinction between disorders characterized by fear and those characterized by distress, and then get into defining generalized anxiety disorder, and then diving really deeply into the function of worry. So what the actual process of worrying does in people with generalized anxiety disorder. And then towards the end, we'll touch on separation anxiety disorder. Okay, so this is an example of a latent variable model where symptoms of a range of DSM-5 disorders, including panic disorder, social anxiety disorder, specific phobia, major depressive disorder, generalized anxiety disorder, and PTSD, are all regressed onto underlying latent factors. And this statistical technique, without getting into the details, kind of allows us to see how disorders cluster together. Because all of our disorders are highly comorbid with each other, taking this statistical approach can help us to start to understand whether this comorbidity is driven by things like symptom overlap, a lack of specificity of diagnoses, or whether it might be shared by common underlying risk factors and mental processes that manifest in different symptoms. So far in this class, in most of the disorders that we cover in this class will fall under the broad category of internalizing disorders. These are forms of psychopathology where mental, emotional distress and pain is basically turned inward, where most of the symptoms have to do with patterns of thought and avoidant behavior that primarily hurt the self. The other category of psychopathology, the other broad category, is externalizing disorders, where psychological pain and distress is expressed in behaviors that may hurt other people or may be considered antisocial and related to law breaking. Most of the externalizing disorders we'll talk about today in this class, fall under the umbrella of substance use disorder. Also, several of the personality disorders share features with the externalizing latent factor. But so far, the disorders that we've talked about have all fallen under the internalizing umbrella and then clustered together again under another latent variable. These are all disorders that are characterized by inappropriate or extreme or maladaptive experiences of fear. We've already made a distinction between fear and anxiety. Today, we're going to be talking about another distinction, another physiological, cognitive, emotional process, worry. But the disorder that we're going to talk about today, generalized anxiety disorder, although it is an internalizing disorder, and although we classify it as an anxiety disorder, when we look at the disorders whose symptoms most often co-occur with and most often resemble the symptoms of GAD, these are disorders that are characterized not by fear, but by distress. So just as a reminder, so far we've talked about the distinction between fear and anxiety. Fear is an immediate response to a danger in the environment. It activates the fight or flight system. It primes us to engage in behaviors that save our lives in the face of immediate danger. Anxiety is a lower level activation of the sympathetic nervous system that is appropriate when we're in situations that are not currently dangerous, but where danger is likely. So anxiety would be an appropriate response, not when you're actually being chased by a tiger, but when you know that you're somewhere where there are tigers around. It makes you vigilant, it puts you on guard, and it makes you more likely to go into a full-blown fear, fight, or flight response as soon as you notice something in your environment that seems to warrant it. Both of these emotions fall under the fear umbrella because anxiety is a physiological state that primes us to feel fear. Generalized anxiety disorder, though, is characterized by another process called worry. So just like fear and anxiety, worry has some adaptive functions, which we'll talk about later in more detail. But our ancestors who had the tendency to worry, who had the cognitive capability to worry, to think about the future, to think about what could go wrong, to think about danger that's not just potential, it's not likely in your current environment, but danger that's hypothetical in the future. So whereas fear would be an appropriate response to being chased by a tiger, anxiety would be an appropriate response to being in an environment where there might be tigers nearby. Worry is what happens before you ever leave your house or before you ever leave your cave, when you're thinking about yourself in a future state where you might encounter tigers. So as you can kind of see from this example, part of worry is this sort of distressing rumination where you think about worst case scenarios in ways that raise your own anxiety and distress level, but don't necessarily help you solve problems. So thinking about how upset your family would be if you did get eaten by a tiger. But then the other part of worry that is considered more adaptive is that worry about the future allows us to plan for the future and may help protect us from ever finding ourselves in situations that merit fear and anxiety. And it may be the case that the part of worry that makes us feel bad, this sort of projecting ourselves into a future where the worst case scenario has happened, thinking about how upset your parents would be if you got eaten by a tiger, that may create a motivational state in our bodies, a sense of worry and dread and apprehension that actually motivates us to engage in the other process of worry, the problem solving part. This would be terrible. It's not happening right now, but I think about how terrible it would be to motivate myself, even though it's not an immediate present danger, to solve it. So the definition of worry is that it's a verbally mediated conscious process, whereas anxiety and fear both refer to physiological states primarily that influence our cognitive experiences. Worry is kind of the other way around. It's a cognitive process that can influence our physiological state. Generalized anxiety disorder is characterized by both excessive anxiety and excessive worry. And these two things feed into each other. When we're feeling anxious, we're more likely to engage in cognitive processes like worry. And when we engage in the cognitive act of worrying, it increases our level of anxiety. So the diagnostic criteria for GAD are that someone experiences excessive anxiety and worry more often than not, more days than not, for at least 6 months, and experiences difficulty controlling the worry. This is really crucial. In GAD, the process of worrying leads to physical anxiety, which has physical symptoms of restlessness, irritability, tension, difficulty concentrating, and difficulty sleeping. And like all anxiety disorders, GAD is only diagnosed when this cognitive experience of hard to control worry and physical signs of worry and anxiety cause distress and impairment. So some epidemiology. GAD is relatively less common than the fear-driven disorders. The 1-year prevalence is about 3%, lifetime prevalence about 6%. GAD is more common in adults than in adolescents. Whereas most of the disorders that we talk about primarily have a pubertal or childhood onset, GAD, the onset is harder to pin down in epidemiological studies primarily because it is chronic, but it tends to wax and wane. And it tends to be worse when someone is experiencing life stressors. So any kind of transition period, including the transition into puberty, the transition into college, the transition into various adult roles, all of these transitional times are times when an individual who's predisposed to having generalized anxiety disorder is more likely to have an exacerbation of their tendency to worry and to experience distress and impairment enough to make them meet criteria for GAD. So in GAD, multiple studies have now found that the things that people with generalized anxiety disorder worry about aren't any different from the things that everybody worries about. They only differ in the intensity of their thinking about it, the frequency, and the distress and impairment that come from the process of worrying. So the most common things that people with GAD worry about, again, are things that we all worry about. So their health and the health of their loved ones, their relationships, whether they're romantic relationships, friendships, worrying about whether your friends still like you, worrying about the status of your marriage or your relationship with your children. People with GAD worry about money, they worry about work, and they worry about the state of the world. So again, none of these things are unusual to worry about. And what makes GAD unusual, what makes it deviant, is that the worry is so difficult to control and causes so much distress. Those are more sort of typical worry content for adults. Because people with GAD worry about things that their peers worry about, children with GAD might have slightly different worries. So anxious, worry-prone infants might seem to experience some worry about the possibility of loud noises. So I had a patient whose little sister was like 2, and the sister was always kind of apprehensive that a loud noise would happen because she was really scared of loud noises. That's a very normal experience for little kids. But what made the sister seem like she might be sort of prone to developing an anxiety disorder or having GAD was that she was always worried that there'd be a loud noise, even when there was not necessarily reason to think that there would be. Preschool age kids, their worry topics would revolve around things like being alone, finding themselves in a dark room and not being able to turn the lights on, worry about being hurt by animals or imaginary creatures. And then by school age, worries start to become more similar to adult worries in GAD. So worrying about negative evaluation by peers, worrying about getting sick or hurt, worrying about natural disasters, but also some more sort of childlike beliefs, beliefs in monsters, beliefs in ghosts or witches, so supernatural beliefs. And then by adolescence, the topic of normative worries and also the topic of worries in GAD is basically pretty similar to adult content. So in this lecture, I'm really going to focus on the role of worry as a perpetuating factor in generalized anxiety disorder and as basically a form of avoidance. So we're going to talk about 5 different ways that worry can function to perpetuate the symptoms of GAD and that worry can serve as avoidance. So the first is people sort of intentionally worrying, people who have positive beliefs about worry, people who believe that worrying is their best way to solve problems. So as I said, worry is to some extent adaptive. It serves a survival purpose of problem solving, and thinking about our environment of evolutionary adaptation, it does seem like it would be more adaptive for our ancestors to think about the dangers that they would encounter outside of their cave before leaving the cave so that they could kind of ready themselves and prepare. So again, this isn't the same thing as anxiety, which when it's sort of a normal reaction is being provoked by actually being in an ambiguous or potentially dangerous environment. Worry happens when you're safe at home, but thinking about putting yourself in a situation that might in the future provoke anxiety. So it has adaptive functions. And people with GAD often will intentionally use worry as a coping strategy. They will use it as a way to manage their anxiety. So the thought process is, I'm feeling really anxious. There must be a problem for me to solve, and worry is the way that I solve problems. So feelings of anxiety, which again, people with GAD are prone to anxiety. They have a lot of the same predisposing factors for developing a disorder as people with other more fear-driven anxiety disorders. They're more reactive to the environment. They're more likely to feel anxiety in response to stimuli that might not make others feel anxious. But that feeling of anxiety, that physiological state, can trigger the worry process. But over the long term, worry maintains anxiety for reasons that we'll talk about in the next couple slides. People with GAD will often tell you, especially like early in treatment or before they've been exposed to treatment, that they have to worry because how else would they solve their problems? And people who have this belief about worry would often articulate something like, if I'm still feeling anxious about something, it means that I haven't solved it yet. It means that I haven't thought about the problem enough. It means that I haven't thought about it from all angles. It means that I haven't projected every possible outcome. And if I can just do that, I won't feel anxious anymore. Worry is a way to cope with and get rid of anxiety. So how does worry as a maladaptive coping strategy develop? It's a behavior, it's a conscious cognitive process. So what is reinforcing it? One way of thinking about it is that worrying may be negatively reinforced just through anxiety kind of naturally subsiding on its own or problems naturally solving themselves or getting solved. But crucially, people who go on to develop GAD or who have GAD attribute the anxiety reduction or the problem being solved to the process of worrying. Looking back on it, they think, I'm really glad that, the worst didn't happen. What prevented it from happening was that I spent a lot of time thinking about it and thinking of ways to prevent it from happening. Rather than thinking, I'm really glad the worst didn't happen. It was unlikely to happen anyway. I was able to solve the problem and then move on from it. Worry is a repetitive process, so there's no natural endpoint to worrying. You can sort of think that worry will lead you to the solution of a problem, but by definition, there's always more uncertainty, more possible outcomes, more what ifs that make worry kind of an unsatisfying, never-ending process for most people. So in GAD, worry becomes a learned behavioral response to anxiety. Initially, it was negatively reinforced when anxiety subsided on its own or problems got solved. But as GAD progresses, worry just becomes kind of automatic. It's triggered by being in an anxious state, and it kind of just starts to happen unconsciously. And this is true even when the anxiety that people are feeling isn't caused by a problem that they can actually solve, or that even needs to be solved. So worry kind of becomes decoupled from its problem-solving origins and basically just becomes an automatic response to feeling anxious. So worry is a behavior, and it's also a very verbal process. It's kind of like talking to yourself in your own head. The idea behind worry as a form of avoidant coping is that by verbally worrying, by talking through problems in a verbal way, we keep ourselves from actually experiencing the mental imagery and emotional side of our thoughts. By focusing on verbalizing our thoughts and verbalizing our fears about the worst case scenarios or things that we don't want to happen, we prevent ourselves from also mentally sort of picturing, projecting ourselves into those situations and sort of feeling the emotions that we would feel in those situations. And in that way, it might be the case that worry prevents physiological habituation or even safety learning. We're thinking about potential dangers, we're thinking about things that we don't want to happen, we're thinking about the worst case scenario, but we're not really letting ourselves fully feel what it would feel like, fully put ourselves in that situation, picture it, and let ourselves feel it. Two pieces of evidence that both that worry is a verbal process and that it prevents us from making mental images and feeling our feelings, feeling our thoughts. People with GAD actually experience what's known as autonomic restriction, where they experience relatively less sympathetic arousal to stress than people with other anxiety disorders. So just like thinking back to the selective mutism lecture, one piece of evidence that kind of disproved the idea that selective mutism is basically freezing in fear from extreme social anxiety. What disproved that was evidence that kids with selective mutism actually show lower sympathetic arousal during situations where they'd be expected to talk but aren't talking, compared to kids with social anxiety who are talking in those situations. And that proved that being selectively mute is an avoidant behavior. It's something that helps to reduce and mitigate anxiety. People with GAD worry a lot, and they experience less of an intense fear response, less of a sympathetic response to stress than other anxiety disorders. That helps to suggest that worry might actually be helping them to keep their sympathetic arousal consistent, because they're always tense, but relatively low. They're not letting themselves experience peaks of fear or intense feeling. People with GAD also show evidence that their parasympathetic nervous system isn't flexible and sensitive to changes in their sympathetic nervous system. It's not good at regulating the sympathetic nervous system, which allows constant low-level sympathetic activation. The parasympathetic nervous system isn't taking over and calming it down. But importantly, people with GAD have chronic low-level sympathetic arousal, but they don't have the intense peaks of fear that people with other anxiety disorders feel. Within the brains of people with generalized anxiety disorder, there's evidence for right hemisphere, there's evidence of left hemisphere dominance and lower right hemisphere activity. So for most people, the language functions in our brain are localized in the left hemisphere. The left hemisphere is the part of our brain where we can verbalize our thoughts. And if our corpus callosum was severed, so the connections between the two hemispheres, we would have absolutely no way of verbalizing what's happening in our right hemisphere because we have no language capability in that side of our brain, or at least we have much less. So when you put people with GAD in an fMRI machine and ask them to think about a situation that worries them or causes them distress, they have way more activity in the verbal left side of their brain and way less activity in the vivid, emotional, imaginal right side of their brain. Whereas people without GAD are having kind of activation in both hemispheres that reflect a conscious verbal process, but also emotional, imaginal experiences of the worries. So taken together, these two pieces of evidence suggest that by focusing all of their cognitive attention on a verbally mediated worry process, people with GAD are actually suppressing imagery and emotional experiences related to their worries. And that is actually helping them to maintain less sympathetic arousal than people with other anxiety disorders. So they are basically avoiding a mental exposure to their own fears. I made this meme as another way of thinking about it. People with GAD, both at an intentional level, but also mostly unconsciously and unintentionally, tend to engage in verbally mediated thoughts about feared situations rather than allowing their right hemisphere to process those same fears in a more emotional, vivid, imaginal way. Another feature of generalized anxiety disorder that helps to explain how worry functions as avoidance is the fact that people with GAD feel really uncomfortable with uncertainty. And so does everyone. We don't like to not be sure what's going to happen to us. We like to have a sense of certainty and control over our lives. But for people with GAD, this anxiety and distress about uncertainty is a lot more pronounced. And so people with GAD are motivated to avoid that distress and anxiety that being uncertain causes by using worry as a way to try to imagine every possible outcome. Even if the possible outcomes they're imagining are really bad, that's still helping to mitigate or avoid the sense of uncertainty of not knowing what outcome will happen. And because people with GAD are anxious, they have this poor parasympathetic control over their sympathetic nervous system that causes chronic low-level stress and sympathetic arousal. The content of their thoughts tends to be congruent with the level of anxiety they feel, so it tends to be relatively negative. When people with GAD engage in worry to mitigate their intolerance of uncertainty, they're not usually thinking about the best case scenarios and the possible good outcomes. They are biased because of their constant chronic anxiety to sort of think about the more negative, fearful outcomes. That's what anxiety motivates us to do. But in this example, worry is not necessarily mitigating stress in general, but it is mitigating stress related to uncertainty by reducing the sense of uncertainty by thinking of everything that could happen. Many patients with GAD also engage in this kind of almost magical thinking where they would say, it makes me feel better to think of all the bad things that could possibly happen because in my mind, thinking about them makes them less likely to happen. Because how often do you think of something and then that exact same thing happens in the future? Thinking about it can kind of be a way of preventing it from happening or sort of insurance against the future. This isn't something that people with GAD tend to literally believe. That I'm not saying that they engage in magical thinking, but there is this kind of bias towards thinking like, if I imagine this scenario exactly, it probably can't, it's unlikely to happen exactly that way. So people with GAD worry a lot. And one of the things that we know they worry about is the implications of worry. In GAD, worry is experienced as difficult to control. And people with GAD worry about that. They feel anxious and frustrated that they can't control their thoughts. They worry about the implications of that and what it means for them. And they also experience a lot of physiological signs of tension and discomfort due to their anxiety and worry. And so they'll worry about the toll that that physiological reaction is taking on their body. People with GAD worry a lot about worrying. This is called metaworry. So because they're so worried about the implications of worry, people with GAD are very motivated to try to suppress their worry thoughts, to try to take their mind off it when those thoughts pop up, to try to like stuff them back down. So as an example, I don't know how many of you have seen The Good Place, but Chidi is a character who is portrayed as probably having GAD or maybe obsessive compulsive personality disorder, which we'll talk about later. But without giving away any spoilers about this show, the characters in the first season are in heaven, but Chidi is very tormented by the fact that even though he's in heaven, he still has anxiety and still has worry. So he has a lot of metaphysical meta worry about the implications of still being anxious in what is supposed to be heaven. That's an example of meta worry. So in GAD, worry seems uncontrollable. And actually, this process of trying to suppress worry plays a really big role in why worry is experienced as uncontrollable. So as a demonstration of this, I'm going to have you do a little self-experiment where you try really hard for the next minute, and I'm going to time it, to try not to think about a white bear. You can think about anything else, but when thoughts about a white bear enter your mind, immediately try to suppress them, put them aside. Don't spend any time during this minute, if you can, thinking about a white bear. So I'm going to start. Don't think about a white bear, starting now. Okay, we're halfway there. Don't think about it. Okay, so it's been a minute. During that time, were you able to suppress those thoughts? And when that minute was over, what was the first thing that popped into your head if you were successful in suppressing? This is kind of a mini example of a pretty famous experiment in cognitive psychology called the white bear experiment, where participants in the study basically spent 5 minutes doing what you just did, trying not to think about a white bear. To keep track of how successful they were at suppressing that thought, they were told to ring a bell every time that they did think about a white bear and fail to suppress the thought. On average, people failed to suppress the thought popped back up about once a minute. Next, participants were told to do the opposite and actively think about a white bear. Similar to the suppression condition, they were told to ring a bell when they did think about a white bear, and they were compared to a control group who hadn't had any prior experience of suppression and were only told to think about a white bear. This demonstrated what's known as a rebound effect, where after making an effort to suppress a thought and try not to think about it, when you do let yourself think about it, or when you stop actively trying to suppress, you experience rebound, and that thought pops into your head more than it would have had you not tried to suppress it. And what this study showed is that participants who had previously tried to suppress thoughts about a white bear thought about white bears more than participants who had never tried to suppress the thought, when both groups of people were told to actively think about white bears. What that shows is that when people with GAD worry about the implications of worry, they are motivated to try to stop worrying, to try to control and suppress their worried thoughts. That ends up having the opposite effect. They may be successful as long as they're actively trying to do it, but as soon as they need to shift their attention to something else or need to think about something else, the worry thoughts pop back up. They experience rebound, where those worries come back even stronger. So the key symptom of GAD, that worry is experienced as difficult to control, that experience of worry being difficult to control is perpetuated by active efforts to suppress worry. And those efforts are driven by metaworry and basically worry that worrying is bad for you. Okay, so the fifth kind of model of how worry functions as avoidance is known as contrast avoidance. So people with generalized anxiety disorder, because of their poor parasympathetic control over their sympathetic nervous system, the fact that their parasympathetic nervous system isn't good at keeping their sympathetic nervous system under control, they basically have heightened sensitivity to stress and negative experiences. Compared to people with fear-driven anxiety disorders, they're less likely to have extreme, powerful responses to those stressors because worrying kind of keeps that at bay, but they are very sensitive to stressors in their environment. Because of their predispositions to anxiety cognitively, they also tend to have cognitive expectations of danger and uncontrollability. Autonomic restriction in GAD, again, just means that people with GAD experience a steady state of moderate sympathetic nervous system arousal rather than the kind of peaks of sympathetic nervous system arousal that we would experience as fear, and that people with social anxiety disorder, panic disorder, specific phobia experience when exposed to triggers for fear and anxiety. So the researchers who initially proposed the idea of contrast avoidance kind of asked the question, if people with GAD are always feeling kind of a low level of anxiety, what is it that worry is really helping them to avoid? It may be helping them to avoid feelings of intense fear by verbally mediating thoughts and not allowing those thoughts to cross over into the more emotional, imaginal side of the brain. But they're not avoiding worry altogether. They're not avoiding anxiety and distress and tension altogether. So what would be reinforcing the process of worrying? It's not necessarily making them feel better, even if it is preventing extreme activation of the sympathetic nervous system. So in a study that provided some experimental evidence of the function of worry as contrast avoidance, people with generalized anxiety disorder were randomly assigned to two conditions. Either they would allow themselves to worry, or they would try to relax. Next, both groups of people with GAD, those who had just worried and those who had just relaxed, were shown a scary movie clip from the movie Psycho. After being shown that clip, the group that had been told to worry beforehand and the group that had been told to relax beforehand experienced equally high levels of fear. So there was nothing protective about worrying in this experiment, just like there was nothing protective about relaxing, being exposed to a scary stimulus caused elevations in fear for both groups. But where the two groups differed is that GAD patients who had relaxed prior to the clip experienced a much larger increase in sympathetic nervous system arousal and fear than those who had been worrying prior to seeing that scary stimulus. So the theory here is that GAD patients are motivated to avoid big shifts in emotion. They don't want to experience that sort of rapid rise in anxiety from a comfortable baseline to elevated sympathetic nervous system arousal. So the idea here is that worry functions to keep arousal at a moderate, steady level. It never goes away. People with GAD are always kind of in their left brain thinking about negative things and scary outcomes. And that contributes to constantly elevated sympathetic arousal. So does the fact that the parasympathetic nervous system is not very good at balancing out and regulating the sympathetic nervous system. But the contrast avoidance model, and this is also consistent with the idea of worry as avoidant coping, suggests that the real function of worry is to keep people always at this moderate level of arousal, so that when something bad really does happen, they don't experience a huge affective swing. They don't experience a change in emotional state. They just go from moderately upset to very upset, rather than going from happy to upset. So in summary, worry has multiple avoidance functions for people with GAD. People engage in thought suppression because of worry about worry or meta-worry. So people think that anxiety is bad for them. That tension and irritability that comes with worry and anxiety is somehow dangerous, and so they should be able to control their thoughts. But when they try to control their thoughts, they may be successful while they're actively working at it, but as soon as they have to think about something else, the thoughts come back. And so people with GAD experience those thoughts as very hard to control. Worry functions to keep people sort of at a distance from their emotions and their imagination. So by thinking verbally about all the bad things that could happen and all the worst case scenarios, people with GAD avoid experiencing the emotions and the imagery that might come with those thoughts. People with GAD tend to have positive beliefs about worry and think of worry as an appropriate way to manage their anxiety or as a necessary problem-solving skill. The contrast avoidance model of worry suggests that worry is kind of this buffer against disappointment and loss. If people are always worried, it blunts the impact of bad experiences when they happen. And people with GAD, because of their cognitive predispositions to anxiety, tend to be people who expect bad things to happen or expect their environment to be stressful and uncontrollable. And then because of intolerance of uncertainty, because people with GAD, more than the rest of us, find it really anxiety provoking and uncomfortable not to know exactly what's going to happen next, by imagining every possible bad outcome, people with GAD think that they'll be more prepared to handle those bad outcomes, or that thinking about it may somehow protect them from actually experiencing it in the future. So we've kind of alluded to sort of GAD specific predisposing factors throughout this lecture, but to kind of make it more systematic, GAD is an anxiety disorder, and it does share overlapping predisposing factors with other anxiety disorders. But compared to the other anxiety disorders that we've talked about so far, GAD is less characterized by fear and more characterized by this sort of more chronic low-level distress, anxiety, and tension. So the predisposing factors that are more associated with maladaptive or inappropriate experiences of fear, things like the ability to form powerful, generalizable, and resistant to extinction fear learning, negative conditioned associations, the tendency to have operant learned behaviors that are strongly reinforced by escape from fear, and the tendency to have really, really powerful, intense sympathetic nervous system responses like panic attacks in response to conditioned fear stimuli or sort of out of nowhere. GAD is less characterized by those predisposing factors and more characterized by predisposing factors that lead to chronic low-level sympathetic activation. So chronic sympathetic activation that is hard to stop and control. This may be caused by impaired HPA axis feedback, where cortisol in the blood doesn't do its job of going back into the brain and stopping the stress response. And it's caused by reactivity to the environment and impaired parasympathetic control over the sympathetic nervous system. This is also known as low parasympathetic tone. So to review the precipitating and perpetuating factors of GAD, The onset of GAD usually comes with a stressful life event or a prolonged stressor. This can be a negative stressor like losing your job or a relationship breakup, or it can even be a positive stressor like getting married or moving to a new city to start a new job. The role of beliefs in perpetuating GAD, it kind of centers on people's beliefs and expectations about worry and uncertainty. So people who believe that they can't handle not knowing what will happen, people who believe that worry is the right way to solve their problems or manage their anxiety, are more likely to continue engaging in this worry process that perpetuates GAD. So worry functions as avoidance in those 5 ways that I talked about. It prevents people from feeling and seeing the worst case scenario in their head, which might allow them to start to habituate to it. It prevents people from experiencing emotional contrasts or rapid shifts from feeling good to feeling terrible. If you always feel kind of bad, when you start to feel terrible, it's not as much of a change. It helps people to avoid feeling like the future is uncertain by allowing them to come up with all kinds of different scenarios for the future. And it may function as a way for people to sort of try to avoid anxiety by trying to worry as a way of managing their anxiety, even if it doesn't typically work to relieve anxiety completely. Okay, so pretty briefly in this lecture, in a little bit more detail in your readings and reflection post, we're going to talk about separation anxiety disorder. So separation anxiety disorder, like GAD, is really characterized by worry and distress. But unlike GAD, where the worry focuses on a whole range of topics and where the topics aren't that different from what everybody else worries about, people with separation anxiety disorder focus all of their worry on concerns that something will happen to them or to their loved ones when they're separated from their loved ones. The avoidance behavior involved in separation anxiety, it's either avoidance of separation or engaging in all of those avoidance functions of worry during separation to cope with the anxiety and distress that separation causes. So even though you might think that children who spend a lot of time with their parents and really rely on caregivers would have more separation anxiety than adults, it's actually the reverse. So about 6.6 to 7% of adults have separation anxiety compared to only about 4% of kids. Like all anxiety disorders, separation anxiety is highly comorbid with other disorders. But in the case of separation anxiety, it's often comorbid with pretty severe mental illnesses or physical illnesses that actually cause someone to need more caretaking than the average person. So both separation anxiety and generalized anxiety disorder involve persistent worry. But like I said, the worry in GAD is not restricted to one topic. It tends to fluctuate and move from topic to topic. The worries tend to be realistic about things that could actually happen, and it has the same content as everybody else's worry. People with separation anxiety disorder worry mostly about separation from someone who has some kind of caregiver role for them. That may be a parent or a spouse who helps you manage your anxiety or your mood symptoms or your physical health symptoms on a day-to-day basis. A lot of parents do have separation anxiety from their adult children, and those children may be actively involved in caregiver roles, or they may be more subtly involved in caregiver roles in that they know that their parent has anxiety about separation, and so they help to provide reassurance. But the comorbidity in separation anxiety disorder does tend to line up with disorders that actually cause someone to be vulnerable or need care. So there's more of an actual need or more of a perceived need for care from other people and from the people that people with separation anxiety fear being separated from. The readings for this class and the kind of the activity involves taking a test, like a paper and pencil test, to learn about your own attachment style. So attachment style refers to how we relate to other people in close relationships, how we maintain our social bonds with the people that we're closest to. And the people that we're closest to tend to be really close friends, our parents, sometimes our siblings, and often our romantic partners. Attachment has sort of 2 main ingredients that you can think of as 2 axes. One axis goes from high anxiety to low anxiety about relationships. So people with high anxiety about relationships are concerned or believe that relationships won't last, that people will leave them, that they can't rely on other people. People with low relationship anxiety feel comfortable getting close to other people, and they feel comfortable relying on people to an appropriate degree, both because they believe that people will stay in their lives and also because they believe that they're capable of taking care of themselves, even if other people aren't there to rely on. The other dimension involved in attachment is how much you seek out or avoid close relationships. So people um, who are sort of low on this dimension of relationship avoidance, but high on the dimension of relationship anxiety. So people who really, really want to be in close relationships, but who worry a lot about abandonment and being left when they're in those close relationships, have what's known as preoccupied or anxious attachment. And this attachment style, wanting to be really close to people, but also being terrified of being abandoned, characterizes most people with separation anxiety disorder. So these are just some excerpts from the article I asked you to read, but this kind of gives some insight into the thought process of people with separation anxiety disorder and how having this kind of anxious attachment style, fearing that people will leave you, causes a lot of problems in relationships and can actually end up pushing people away. So this man, as his wife packed for vacation, he hovered anxiously. She eventually snapped and they argued for hours. That night after she'd gone to the airport, he couldn't sleep. So he engaged in a lot of worries. She'll have a car accident, she'll get sick or hurt, she'll leave me and find someone else. And even though he knows that his worry is unrealistic, I firmly believe that my worry is based in fantasy land. At the core of his worries, he's just deathly afraid of losing this person that he's deeply attached to and in a very close, dependent relationship with. Another person who's profiled in this article is a parent with separation anxiety from her children. So she keeps voice messages from each of them on her cell phone because she wants to have their voice with me as long as I can in case they die. So this could be kind of an example of worry as a way to avoid vivid mental imagery, rather than kind of actually letting herself think about what it would feel like to lose her children and really imagine being in that situation. Instead, she's making all these plans for, well, if they die, I'll have their voices on my phone. When the phone rings, she thinks the worst thing is going to happen, but she's not necessarily letting herself feel it. Okay, so that's the end of today. In class, we're going to be talking more about treatment of anxiety disorders, both the ones characterized by fear and the ones like GAD and separation anxiety, more characterized by distress. And we'll be practicing recognizing and challenging some of the thought processes that are involved in worry and anxiety.